TAVI procedure is the procedure that's nowadays performed almost universally in patients who are awake under local anesthetic. We have an expert cardiac anaesthetist who helps us look after the patient, support the patient, but rarely do we put patients under general anesthesia. The procedure takes approximately about 60 to 90 minutes, and it involves making small needle punctures within the groin and the wrist arteries, and delivering wires and catheters, which are small tubes, to the relevant parts near the heart and within the heart. And then the new valve is delivered over the wire and in place of the existing diseased valve. And then the valve is effectively deployed either slowly through a self-expanding mechanism, or there is a different technique where a balloon is used to inflate the valve frame. The TAVI valves are generally tissue valves which are sewn onto a large metallic stent, and it is that metallic stent which effectively anchors and holds the new valve in place, and once deployed the new valve takes over and works immediately. And patients, generally speaking, are effectively not particularly in pain or in distress when the procedure is carried out, and afterwards the feedback generally is that the procedure was far less invasive and unpleasant than they'd anticipated. Most patients end up spending 2 nights in hospital. Most of that is for observation and recovery, but one of the advantages of TAVI is that patients can ambulate, walk around effectively from the following morning, and so the recovery is quick and relatively straightforward, and they can return home and, generally speaking, return to daily life within a week or two.